Likely the most significant change coming to Medicare Part D prescription coverage in 2025 is the new $2,000 cap on your out-of-pocket prescription drug cost. This cap is designed to provide financial relief for millions of Medicare beneficiaries with expensive medications. But what if I told you that the cap on prescription spending is not what it seems?
But what else could it be?
In this video, we will show you how the $2,000 cap is actually calculated and why it is not as straightforward as most people think. Real quick, my name is Cameron Giardini, and I help operate our Medicare-focused independent insurance agency, Giardini Medicare. Now, regarding the $2,000 cap in 2025, there are a couple of very important things to remember. First, this spending cap does not include your plan's monthly premiums. So for example, if you have a Part D plan that is $30 per month, that $360 for the year would not count towards the $2,000 spending limit. Instead, this $2,000 out-of-pocket cap only applies to medications covered by your Medicare Part D or Medicare Advantage plan if it has drug coverage as well. This means that the medications that you are taking, they have to be listed on your plan's formulary, which again is the master list of medications that a plan chooses to cover during the year. Here on the screen, you can see an example of what a plan's formulary looks like, but don't worry, instead of scrolling through hundreds of pages of different formularies from various insurance companies, you can of course instead use the online Medicare.gov Plan Finder tool to compare all of the different plans available in your area to see which ones do or do not cover your specific prescription medications. We also have this video that you can see that shows how you can do your own 2025 Part D analysis. Remember, some medications are simply excluded from Medicare prescription drug coverage in certain situations. For example, Ozempic is not currently covered if it is only for weight loss. So unless you are also prescribed a medication like that for a covered condition like diabetes, don't expect the medication cost to count towards the $2,000 out-of-pocket limit. Some additional medications that would not apply to the $2,000 cap include medications that are covered by Part B of Medicare, which would be your medical coverage instead. Also, over-the-counter medications, as well as medications purchased outside of the United States, or through discount services like GoodRx or Cost Plus drugs. However, if there is a medication that is generally covered under Part D, but it is not on your plan's specific formulary, let's just say a certain inhaler in this case, you do potentially have the option to request a formulary exception from your prescription drug plan. If this exception is approved, then the medication will usually be covered for the remainder of the year by your plan. So the cost you pay for your medication after a successful exception would count towards the $2,000 limit for the remainder of the year. In 2025, some additional third-party payments will also count towards the calculation of this overall cap. As you can see from this Medicare document, these include payments from the 5 following third-party sources. And lastly, starting next year, enhanced supplemental benefits offered by Part D plans can also count towards this cap. Before getting to the heart of this video, keep in mind that calculating your own $2,000 spending cap, it is not something you should attempt on your own, and it's not even something that you should expect a broker to determine for you with absolute certainty. The examples that we will discuss in this video are purely for illustration, and they are designed to instead help you grasp the complexities of what is happening behind the scenes. First, it helps to be aware of the 3 different phases of prescription coverage for 2025. We have the deductible phase, the initial coverage phase, and finally, the catastrophic phase. Not every plan will have a deductible, and for those of you that do, the deductible may also only apply to certain medications, usually a tier 3 medication or higher. But with that said, know that the maximum prescription deductible for Part D and Medicare Advantage plans is $590 in 2025. Once you have met your deductible, or if it doesn't apply to your specific medications, you move into the initial coverage phase, and that is where you will pay a portion of your medication cost, usually in the form of a copay like $5, $40, basically some set dollar amount, or coinsurance such as 25% or 40%, which again is more of a percentage of the actual medication cost. And you pay these amounts until you reach that $2,000 cap, and then ultimately you reach the final phase of coverage, which is the catastrophic phase. This is when, for the remainder of the year, you would then pay $0 for medications covered by your plan. In 2025, as you may have noticed, there is finally no more coverage gap, which was also commonly known as the donut hole. Thankfully, you don't have to worry about that moving forward.
No donuts!
Also, how you move through these 3 different prescription drug phases and ultimately reach that $2,000 out-of-pocket cap is going to be based on the concept of the true out-of-pocket cost. This is also shortened to the TROOP. Now, I will be straightforward and say this is a complicated topic and it has evolved over the years, so we will try our best to spare the nitty-gritty details when possible, but we will show you why the TROOP calculations are really important heading into 2025. Overall, just think of the TROOP as your $2,000 spending limit tracker. Once that reaches $2,000, you pay nothing for covered medications for the remainder of the year. In 2025, the amount of money that will count towards your true out-of-pocket cost, they will greatly depend on whether or not you are enrolled in an enhanced or a basic prescription drug plan. The differences between the two are often confusing, but here is why the difference is so important. To calculate the TROOP for somebody in an enhanced prescription plan, we would use whichever is greater, the amount you pay out of pocket based on your prescription plan's benefits, or the cost share that you would have had under Medicare's defined standard Part D plan in 2025. For a basic plan, on the other hand, your TROOP, and therefore your $2,000 cap calculations, they are based strictly on what you actually spend out of pocket. Again, I know this sounds confusing, but please stick with me. We will look at 3 real-life spending examples to see how these $2,000 spending cap calculations might look next year for a basic versus an enhanced Part D plan. Another quick note before we do that is that Part D vaccines, which are typically covered at $0, they will also have $0 count towards the TROOP and therefore the $2,000 yearly cap, and also insulins that are covered by your plan with a limit of $35 for a 1-month supply per insulin. Only the $35 is going to count towards the yearly spending limit instead of the full cost of the insulin. Also, before jumping into these different real-life examples, if you want to see which Medicare Advantage plans and Part D plans provide enhanced or basic prescription coverage in 2025, we will link to the file that you can see here on the screen in the video description below. This file is directly from Medicare and it lists each plan in every market and whether they are enhanced or basic. Remember, for each of the following 3 examples we will go over, the standard benefit design for 2025 is a $590 per year deductible, and then once that deductible is met, 25% of the medication cost would count towards the $2,000 limit. Again, this is just the standard benefit, and you'll see why this matters shortly. Let's start by taking a look at an example using Kevin. Although Kevin's situation is a little unique and frankly a little unlikely, it will show you how the $2,000 cap calculations may differ greatly from what you expect. For 2025, Kevin is enrolled in a $0 per month Medicare Advantage plan with enhanced prescription coverage with no prescription deductible and the following cost-sharing structure. Tier 1 medications are $0 per month copay. Tier 2 medications are $10 copays, Tier 3 medications $47, Tier 4 medications $100, and lastly, Tier 5 medications are 27% of the drug cost. However, for 2025, Kevin is only taking a Tier 3 medication with a total retail cost of $1,000 per month. Because Kevin is enrolled in an enhanced plan, his TROOP and $2,000 cap calculations, they will be based on the higher amounts between his actual spending and what the cost would have been under that standard Part D benefit that we mentioned earlier. In January, Kevin goes to the pharmacy and he gets a 30-day supply of his medication and he pays a $47 copay since again he has no deductible with his plan and Tier 3 medications have a $47 copay for a 30-day supply. Now you would logically think that when he does this and fills his prescription, Kevin would pay $47 towards the $2,000 out-of-pocket cap. In this case, of course, you would think he has $1,953 remaining to reach that spending limit for the remainder of the year. But shockingly, that is not the case. Remember, we have to follow the troop calculations, which, for an enhanced plan, is the greater of what you actually pay versus what the standard Part D benefit is. Kevin, with his $1,000 retail cost medication, under the 2025 standard Part D benefit, he would have paid the first full $590 due to the deductible and then 25% of the remaining $410. This would be a total of $590 plus $102.50, which equals $692.50. So, in January, despite Kevin only paying $47 out of his pocket at the pharmacy, in reality, roughly $693 would count towards the troop and, more importantly, the $2,000 cap. This would leave him with $1,307 remaining towards that spending limit for the year. From February through June, when Kevin goes to the pharmacy to fill a 30-day supply of this same medication, he would continue to pay the $47 copay each month out of his pocket. But under the standard benefit, 25% of the medication's $1,000 cost would continue to be counted towards the $2,000 cap each month. For these next 5 months, Kevin would pay $235 out of his pocket, and the $250 per month from the standard benefit would be counted towards his $2,000 cap. This would bring his 5-month total to an additional $1,250. Now, by the end of June, Kevin would have paid a total of $282 for his medications, while his troop would actually be at $1,943 for the year to date. This means he is already very close to reaching that $2,000 cap. In July, Kevin would then pay his final $47 copay for the year, which brings his out-of-pocket cost to $329. But the amount that counts towards the cap reaches $2,000 due again to the standard benefit calculations. Once this $2,000 cap is reached, Kevin pays $0 out of pocket for his covered medications for the remainder of the calendar year, despite not even coming close to paying $2,000 out of his own pocket. Here is a real-world example of Kevin's situation using the Medicare.gov Plan Finder tool. You can see at the top of the page for this Medicare Advantage plan that the total 2025 estimated costs are $329. If we scroll down, you'll see that the retail price for this medication is almost $1,000 per month, and just like with Kevin, it is a Tier 3 medication with a $47 copay. In this case, it projects that you will pay these copays until the end of July, when you would reach the $2,000 cap, even though again, you would have paid much less than $2,000 out of pocket. Real quick, let's compare these 2025 costs for Kevin to what he might have paid in 2024 with the same prescription medication with the same $1,000 retail cost. If Kevin had this same Medicare Advantage plan with a $47 Tier 3 copay and no deductible, he would have paid approximately $1,985 out of his pocket over the year in 2024, which of course is much higher than the estimated $329 in 2025. For our next example, let's explore a more complex scenario that uses a realistic Part D plan and multiple medications across different tiers, but with a plan that is also considered an enhanced Part D plan. For this, we will consider Bill, who has a Part D plan with a $10 monthly premium and a $590 deductible that applies to Tier 3 through Tier 5 medications. His plan's cost-sharing structure is as follows. Tier 1 medications are $0 per month, Tier 2 medications, $5. Tier 3 medications require you to pay 20% of the retail cost after the deductible. Tier 4 require 45% after that deductible. And then Tier 5, 25%, of course, after the deductible. In 2025, Bill is prescribed a Tier 3 medication with a retail cost of $900. He also takes 2 Tier 2 medications with a retail cost of $20 each and 2 Tier 1 medications with a retail cost of $10 each. In January, Bill pays $590 towards the deductible out of his own pocket for his Tier 3 medication. This leaves $0 of his remaining deductible, but still $310 of his $900 medication cost remains. He would then pay 20% of the remaining $310 because of his plan's coinsurance, which would be an additional $62 out of his pocket. He would also pay $10 total for the Tier 2 medications and $0 for the Tier 1 medications. This brings the total amount he actually spends out of his pocket in January to $662. Under the 2025 standard benefit, Bill would have still paid the full $590 due to the deductible, and then again 25% of the remaining $310. He also would have paid 25% for his Tier 1 medication and Tier 2 medications. So using the standard benefit design, Bill would have paid $682.50, which counts towards his $2,000 cap compared to the $662 he actually paid out of pocket. From February to June, Bill would pay 20% of the $900 Tier 3 medication, a $0 copay for his Tier 1 medication, and a $5 copay for each of his 2 Tier 2 medications. Over these next 5 months, this would result in him spending $950 out of his pocket. However, under the standard Part D benefit, Bill would have paid 25% for each of these medications, which would have totaled $1,200 instead. By the end of June, Bill will have paid $1,612 actually out of his pocket, while $1,882.50 would be counted towards his $2,000 cap due to the standard benefit cost and the troop calculations. Lastly, in July, Bill would only pay 20% of the $900 medication since he will reach the $2,000 cap during this month. When it is all said and done, Bill will have paid about $1,700 out of his pocket to reach the $2,000 cap for the year, and for the remainder of the year, his medications will of course be $0 out of pocket as long as they're covered by his Part D plan. Here on the screen, you can see a similar situation to Bill's using Medicare.gov. In this case, the medication's retail cost is roughly $950 per month, and it is also a Tier 3 medication with 20% coinsurance. We also included 2 Tier 2 medications and 2 Tier 1 medications. This real-life example shows a total estimated medication cost of $1,669 for 2025, and then we can add the premiums of $16.30 per month for a total 2025 estimated out-of-pocket cost of $1,864. Again, this means he would spend less than $2,000 despite reaching the cap, even if we include monthly premiums. Instead, what if Bill enrolled in an enhanced Part D plan with a much higher monthly premium, but with stronger prescription drug coverage? In this case, assume Bill's Part D plan instead has a monthly premium of $90 per month, no deductible, a $5 copay for Tier 1 medications, a $10 copay for Tier 2 medications, and a $47 copay for Tier 3 medications. We'll skip Tier 4 and 5 since we won't use those in the example. Again, Bill is taking 1 Tier 3 medication with that $900 retail cost, as well as 2 Tier 2 medications, each with a $20 retail cost, and 2 Tier 1 medications, each with a $10 retail cost. In January, Bill would pay $77 out of his pocket due to the specific copays with this Part D plan. However, under the 2025 standard Part D benefit, Bill would have paid, again, the $682.50, which would count towards his $2,000 yearly cap calculations, which leaves $1,317.50 remaining. From February to June, Bill would pay an additional $385 in copays, bringing his actual yearly out-of-pocket cost to $462. However, from February to June, under the standard Part D benefit, Bill would have paid $1,200 for his medications, so instead, that amount is counted towards his troop and his yearly cap calculation, which results in a year-to-date total of $1,882 towards his $2,000 cap. Finally, in July, Bill would pay his $47 copay one more time for his Tier 3 medication, and he would reach his $2,000 yearly spending limit. Despite him only actually spending $509 out of his own pocket for covered medications for the year, he is covered for the remainder of the year at no cost for covered medications. When we compare these two different scenarios for Bill, somewhat surprisingly, the Part D plan with the much higher premium would actually end up costing less overall compared to that much lower premium plan. With the lower premium plan, Bill would pay $120 per year for his premiums and $1,700 for his medications, for an approximate total of $1,820. If we compare this to the higher premium plan, Bill would have paid $1,080 for his yearly premiums, but only $509 for his actual prescription medications, bringing his yearly total to approximately $1,600 for the year, which is roughly $200 less for the year compared to that low premium option. Again, let's compare this hypothetical scenario to a real-life example from Medicare.gov. We see that with these same medications as our previous example, if Bill instead considers the higher monthly premium plan, Bill would be estimated to spend $461 in 2025 for medications, and then we combine this with an $86.40 per month premium. This would be an estimated total spending of $1,498, which is lower overall than the plan we previously talked about even on Medicare.gov with a much lower premium. And frankly, it's lower than even a zero premium plan. For our final example, let's move away from enhanced prescription drug plans and let's take a look at what happens if somebody enrolls in a standard Part D plan that is considered a basic plan. Remember, for prescription drug coverage with a basic plan structure, only the cost that you actually pay out of your pocket will count towards the cap, not the cost based on the standard Part D benefit. For this example, we will use Stacy. Stacy has a basic Part D plan with a $15 per month premium. Her plan has a $590 deductible that applies to all medication tiers, and then after her deductible, her plan has the following cost sharing. Tier 1 has a $0 copay, Tier 2, $5, Tier 3 has 21% coinsurance, Tier 4 has 40% coinsurance, and Tier 5 has 25% coinsurance. To keep things as easy as possible, Stacy is taking the same exact medications as Bill from the previous example. In January, Stacy pays $665 total out of pocket using the breakdown that you can see here on the screen for her different medications, including the deductible. Remember, only the $665 counts towards her $2,000 cap, and it is not compared to the standard Part D benefit like our previous examples. From February through July, Stacy pays $199 per month based on the different cost sharing for her prescriptions, as you can see here again on the screen. Adding up these 6 months would result in Stacy paying $1,194 out of pocket, which brings her year-to-date spending up to $1,859. This leaves just $141 remaining until she reaches her $2,000 spending cap. Stacy would then reach this $2,000 cap in August when she fills her prescriptions again. The main difference between Stacy and our previous examples is that Stacy will actually pay the full $2,000 out of her own pocket to reach the yearly spending limit due to her enrollment in a basic Part D plan. You can also see this play out here on Medicare.gov using a real-life example to show Stacy's situation. Just like we showed with the basic Part D plan, Stacy would spend an estimated $2,000 for the year. Now, this does not mean that a basic plan is never going to make sense, but it is something to consider. After looking at our different examples, we think that there are some important trends that you should be aware of as we head into next year. First, for those of you with low-cost medications who will not reach the $2,000 cap, you'll probably notice very little difference between basic and enhanced prescription plans. However, for those of you with more expensive medications, enhanced plans may end up being more compelling. One of the biggest difference makers for 2025 will be if an enhanced plan has a fixed dollar copay amount for expensive medications. This might be a $40 copay for Tier 3 medications instead of a percentage like 20%. The lower the plan's copays compared to the 25% standard benefit, the easier it will be for you to reach the $2,000 spending cap without actually paying $2,000 out of pocket. This is why when we look at all of the Part D plans available in our home state of Michigan, for our example, only a small handful of Part D plans offer Tier 3 medications with a copay instead of a percentage. And if they do offer it with a copay, you can see that the plans have a much higher monthly premium. Last but not least, based on recent market trends and our personal experience as brokers, it is likely that Medicare Advantage plans will offer more enhanced prescription drug benefits, providing relatively stronger prescription coverage with low to no deductibles and more fixed dollar copays for Tier 3 and even possibly Tier 4 medications compared to standalone Part D plans. Don't be surprised if you see Medicare Advantage plans having lower overall projected premium cost when you do your analysis heading into 2025. And you will even see on Medicare.gov that they specifically say you might save money by considering Medicare Advantage options. So I think it's pretty clear which way they want you to go. Although we wanted to show you in this video how to better understand the $2,000 Part D spending cap for 2025 and how it differs from what you might have expected, we don't want you to sit down and try to calculate exactly what your cost might be for 2025 on your own. Instead, to find prescription coverage that is right for you, you should of course use the online Medicare.gov Plan Finder tool to input your medications that you expect to take in 2025. Then, like always, you can sort the plans by the lowest overall projected out-of-pocket cost, which also includes the monthly premiums. And to make this even easier, you can watch our Part D analysis tutorial video right now for a step-by-step guide.